campus. It is my pleasure to formally welcome you and extend you a warm welcome to this 13th annual Mental Health Awareness event. We have been doing this event for many years to coincide with Mental Health Awareness Month in the month of May in our effort to promote education about the critical mental health needs in our communities and mental health services that are available to our community. We had allowed a little bit of time because we noticed that some students and other participants did not have the links to join the event, so excuse the little delay that we had. Certainly, this has been a very trying last year and a half as we all have been going collectively through the trauma of the COVID-19 pandemic. Last year, when we held this event, we focused on the integrated care approach to the issues that we were facing. And as we have continued to deal with this issue, we have found new ways to be resilient and to do what we can do to take care of ourselves, our loved ones, and our larger community. Now that we have a glimmer of hope due to vaccinations and better treatments, more effective treatments that are now available at hospitals and healthcare centers worldwide, it becomes imperative that we take a look at what is impeding the vaccination efforts in terms of vaccine hesitancy. And it's also very important that as clinicians, we take a look at the mental health issues that have been affecting our community to a larger degree. And we will address some of those issues in today's events. They include suicide, substance abuse, domestic violence, divorce, phobias, and a rise in psychiatric, neurological, and physical ailments that we have to face along with our clients when we are providing mental health services to them. I wanted to thank especially our three presenters, but first of all, kudos to our mental health counselor, mental health counseling coordinator, who is a licensed psychologist and mental health counselor, Dr. Tania Diaz, for putting together this event and engaging the wonderful presenters that will be sharing their expertise with you today. Thank you so much, Dr. Diaz, for your work on this event. Also, a special thank you to Nestor Del Valle, our Blackboard administrator, without whom we could not function as effectively as we do, and Jose Algozain, also to our departmental assistants, Jose Olivera and Natalia Acosta, for their support. We will be featuring three presentations on the topics of teen suicide by our professor in the undergraduate and education programs, Yamila Lescano, who has extensive expertise in treating children and with a special consideration for autism and other developmental disorders, and she will be addressing teen suicide today. Also, we are featuring Dr. Amanda Shays, professor at the allopathic medicine department at Nova Southeastern University, one of our local universities. And also we will be featuring a professor from our clinical psychology PhD program, Dr. Isaac Turgeman, who has extensive expertise in the neurology, psychology area. And as we know, COVID-19 causes a number of symptoms that are vascular, respiratory, and neurological as well. So he will be addressing that portion. Dr. Tania Diaz will be presenting more extensively the credentials of our presenters. I want to say thank you to the three of you for agreeing to present today for us. We very much appreciate your efforts. I need to tell you a little bit about some housekeeping chat box any questions that you have. We will allow at the end at least a half hour for questions and answers so that our presenters can tend to your questions and your comments. You will be able to either write it there or open your microphone and ask your questions. We are offering today 3 complimentary continuing education credits for those of you who hold licenses as a psychologist, a mental health counselor, clinical social worker, or marriage and family therapist. Also, since we have invited guests from our HERSA grant project, which allows us to provide a special training to our students and contribute to building capacity in the county to train master's level clinicians who can deliver services effectively in integrated behavioral healthcare settings. We have also arranged to allow for 3 credits of nursing license continuing education credits. Later on, I will be pasting in the chat box the evaluation link. It will be important for you to complete it. I know that many professors are offering extra credit or are requiring this presentation depending on the subject of their courses. Our assistant is tracking your attendance.
Los audio. Néstor.
Sí.
Yo no oigo nada aquí, Mike.
University has been providing free continuing education units on educational lectures in honor of mental health awareness for the last 13 years. And its basic foundation is to raise awareness about the importance of emotional and psychological well-being. Now this year, we've expanded our offerings and to include complementary educational units to our nurses, which are frontline workers in the field. So a special thanks to them, their families, for the long hours and sacrifices that they've had to make. Response files associated with COVID vaccinations and the plethora of mental health concerns attributed to the pandemic, with a special emphasis on teen suicide. The presentation will discuss not only the impact of COVID, but how to identify early symptoms of suicide amongst our youth, which is very well needed. And we're going to close the event by outlining integrated health interventions and relative information regarding vaccinations to address also and touch upon the controversy associated with vaccines. So we're going to go ahead and kick off with suicide awareness by Professor Lescano. Just a little bit about Professor Lescano. Professor Lescano is an assistant professor at the undergraduate psychology program and education program at Albizu University. She's a licensed mental health counselor and a qualified clinical supervisor with private practice in the Miami area. She has over 10 years of experience in the infant mental health field and early childhood developmental disorders with a special interest in autism. In addition, she has training in parent-child psychotherapy and holds several certifications in the field of infant and maternal mental health. She has extensive experience serving diverse populations, including drug dependency core clients, foster care, and children with developmental disabilities. She is also, to say the least, a youth mental health first aid instructor and the program director for the Miami Mental Health Awareness Initiative at Albizu, funded by Assumption. So without any further ado, I'm going to turn the mic over to Professor Lescano.
Thank you for the introduction. Thank you, Dr. Diaz, for the introduction and for allowing me to be part of this event one more time this year. And thank you, Dr. Barroso, also for the inclusion in this special event. Thank you, everyone, for joining. As Dr. Diaz mentioned, I'm also the director for the Miami Mental Health Awareness Initiative. And this initiative seeks to train school personnel throughout Miami-Dade County precisely on recognizing the signs and symptoms of mental illness in youth, in adolescents. Suicide is never an easy topic to talk about. It's actually sometimes very awkward. And for that reason, it's very important that we make an effort, especially mental health professionals, in continuing to raise awareness about the seriousness of this topic. Let me see here. So let's start. Suicide awareness, the ripple effect of COVID-19 in teen suicide. We don't have updated statistics about what it's looking like. The last statistics we actually were able to obtain in regards to suicides were from early stages of the pandemic. So we're talking about around April through June 2020. Although we're not able to really anticipate what it was going to look like post-pandemic, I mean, some of the statistics that I will be presenting this afternoon will give you an idea of the importance of being prepared as mental health professionals to work with youth and adolescents as soon as they transition, especially back to school. So let's start first by defining what is suicide. And suicide is death caused by self-directed injuries behavior and with an intent to die as a result of the behavior. Suicide attempt is also defined as a non-fatal, self-directed, and potentially injurious behavior with any intent to die as a result of the behavior. And suicide attempt may or may not result in injury. As I mentioned before, suicide is the global public health concern. So this is not just a concern we have in the United States, but it's also globally. Suicide presents a major challenge to public health, as I mentioned, in the United States, globally. It contributes to premature death, morbidity, loss of productivity, and healthcare cost. And we're going to look into those points a little bit more later. According to the CDC, the Center for Disease Control and Prevention, the suicide rate in this country has increased 35% from 1999 to 2018. And suicide is now the 10th leading cause of death in the United States. In the last decade, suicide rates have increased, especially in youth, so ages 14 to 18, becoming the second leading cause. Suicide claimed the lives of more 48,000 Americans in 2018, resulting in about one death in every 11 minutes. In 2018, 10.7 million adults in the United States seriously thought about suicide. 3.3 million made a plan for suicide, and 1.4 million attempted suicide. So these are from 2018. So this is what it was looking like prior to COVID-19 pandemic. Let's explore really quick the suicide disparities. For example, more than 20 veterans die by suicide every year. Between the years 2008 and 2017, the number of veterans suicides exceeded 6,000 every year. For the LGBTQ young adults, ages 18 to 25, it was reported that they contemplated suicide at a rate more than 4 times higher than heterosexual young adults, same age. More than 1.8 LGBTQ between the ages 13 and 14 seriously consider suicide each year. Suicide is also the second most common cause of death among teenagers and young adults, and at the rate of suicide for youth aged 10 to 24, increasing 56% from 2007 to 2017. The rate has also tripled for girls in ages 10 to 14. And in 2019, study also found that self-reported suicide attempts among Black teens has also increased to a 73%, 1991 to 2017. Now, let me ask you a question. Suicide rates among teenagers have continued to increase. Which gender do you think is the most affected? And just type it on the chat. Which gender you think is the most affected by suicide? And I just gave you some leads. Estrella says women, Maria, women, Mariana Levy, women. Yes, very good. One said men, Danielle, females. Yes, and you're right on target there. Girls, they tend to be more, actually have higher rates of suicide attempts compared to males, especially during adolescence. So let's think about what's going on during this particular period of adolescence that could make girls more prompt to suicide, to suffering from depression and anxiety that later on might continue to exacerbate and have higher rates of suicide. Think about, for example, as they are transitioning through adolescence, certain biological changes such as puberty, right? So there's been a lot of research about girls, especially who reach puberty before their peers in the same group, becoming depressed, and sometimes this could lead to suicidal ideations, and this in combination with other environmental issues might trigger suicide. Also think about the difference between gender. Girls tend to invest more in relationships than boys, right? And not only in friends relationships, but also in romantic relationships. Think also about girls being more active in relationships involving roles with siblings, with parents. So a lot of these different aspects have been shown to have a correlation with higher depression for gender, females, and also in relation to later on exacerbation of these symptoms and suicide. So very good, everybody. Thank you for participating. Let's look at suicide from an ecological framework, and perhaps you already have taken courses where you have the opportunity to study Bronfenbrenner, right, and the ecological model. So this is very similar the way we have to look at suicide. Suicide is just not just one single factor. We have to think about it as a myriad, right, of different aspects or domains that are interrelating with each other. So, for example, when we look at suicide, we look at risk factors and protective factors, right? So suicide, like other human behaviors, has no single determinants, as we mentioned. So when we look at all these different domains, we think about the biological domains, the psychological, the interpersonal, the environmental, and societal influences that interact with each other over time. The social ecological model, it's encompassing multiple levels of focus on the individual and the relationship, the community, the societal, and it's a very useful framework in especially planning interventions at all these different levels to be more effective in preventing and reducing suicide in our youth. Now, when we think about, for example, suicide, and we look at the risk factors, think about the risk factors at an individual level. What comes to your mind? And you're free to type in the chat. What comes to your mind when you look at the individual level? What could be some of the issues? So it could be a history of depression. It could be an existing mental illness, right? It could be hopelessness, feeling hopelessness, substance abuse, certain health conditions, a previous, perhaps a suicide attempt, or even a family member or a loved one or a friend that has committed suicide. So that's at an individual level. Think about now, through the pandemic, how many, people that we know, or, students or adolescents, unfortunately had the experience of losing a loved one, right, in the family as a result of COVID, or had experiencing depression or anxiety as a result of being isolated and losing perhaps connections with people very close to them. We mentioned earlier nurses. Think about family members of nurses and those who are on the front line who are working long hours, and adolescents and their family, their children might worry about them, right? So all those are the individual level. Now, when we look at the relational level, think about that individual level of support, right? So think about the individual level of support, and not only the level of support, what is the perception of that individual level of support? Think about perhaps individuals who might have relationships that are abusive, or live in an environment in the home where the quality of that atmosphere is not the best. Not only there might be domestic violence, there might be intimate partner violence, but there might also be isolation where there is a social disconnection from family and friends. Think also about financial and work stress. How many individuals throughout the pandemic lost their jobs? Many even lost their homes, and if they were lucky enough, they were able to travel across the country and be able to live with a family member. So, moving, losing their homes, losing their jobs, having that financial instability, those are triggers in this case, especially for our youth. At the community level, I want you to think about the inadequate community opportunities, especially when it comes in terms of barriers to healthcare. Think about many areas in our country, even in our particular state in Florida, where there is very little help when it comes to mental health services, or perhaps there's a high concentration of people living in a particular area where they don't have access to mental health services, or they don't have health insurance. And sometimes, even for those who have the health insurance, it might be really expensive. I've had, clients in my private practice that their co-payments could be higher than what the insurance actually pays for the visit. So they're not always able to afford that, especially if they are on a weekly basis, attending to services. Also think about, lack of access to a community that is not that well connected, where they don't have the resources they need, or sometimes they don't know in the first place where to find those resources in their own community. At the societal level, reflect on what is the availability of youth and certain people to lethal weapons. How much they're exposed to, violence, not only in the neighborhood, but also in the media. Nowadays, we have kids spending more time in front of the computer. Parents might assume that they are, doing homework, engaged in some sort of remote learning activity, and they might be actually engaged in exploring, web page or some sort of media that might relate to violence. So it's important that we can with good supervision when it comes to that. But also, when you think about the societal level, it also comes into play the stigma. What is like in my society, and also in my culture, the culture of my society, when it comes to mental health related challenges or mental illnesses. As we know, still there's a lot to do about mental stigma, mental health challenges and illness stigma And precisely these events, that's one of the contributions to raise awareness and to contribute to reduce stigma. Let's move to what are the protective factors. So the protective factors are those that are going to help us to reduce the risk factors, right? So as protective factors, we have those that are going to buffer, right, against the risk for suicide. And it can be found across the different domains that we mentioned just now. So think about an individual that has a healthy relationship within the family, family is supportive. They also are in the community where they're very well connected in the community. Another protective factors could be a young person or a youth that has good coping skills and problem-solving skills, that they've been able to learn that not only within their family of origin, but also in the context of their community and school. They have moral or religious objections to suicide, strong and supportive relationship with friends, with romantic partners, and any other, teachers, coaches that are important people in their lives. Connected to school and of course to community, as I mentioned before, and many other social institutions, they're part of a particular club. It could be a religious group. It could be being very active in sports and arts. All of those are going to be protective factors. And also the availability and quality of ongoing physical and mental health care, and the reduced access, of course, to lethal means. Suicide is also connected to other forms of violence. Exposure to violence, for example, a child that is being raised in a family atmosphere that is charged with violence, with abuse, also that is being exposed to bullying. And nowadays, again, going back to the issue that there's so much time in the electronics and the computer, they might be also targeted as, through cyberbullying. Think about peer violence or even violence within the own community, within the school. All of those are associated with, triggers for suicide. And also increased depression, post-traumatic stress disorder, etc. Women exposed to partner violence are nearly 5 times more likely to attempt suicide as women who are not exposed to partner violence. Exposure to adverse experiences in childhood, such as physical, sexual, emotional abuse and neglect, and living in homes, as I mentioned before, with violence and mental health illness, substance abuse problems, and that present instability in their lives and trauma, it's also associated with an increased risk for suicide later on. Also think about the psychosocial effects of violence in childhood and adolescence, and it can be observed later. Even research in relations to bullying and cyberbullying have been now a lot of extensive research looking at the effects later on in adulthood in terms of trauma and in terms of continuous depression triggering suicide attempts. Think about with COVID-19, how many families enduring some of the elements that we're mentioning here, like struggling with finance, losing their jobs, and stress factors about the instability of whether I'm able to pay the rent or not. All of those triggers affecting the family, of course, it's going to affect the whole family system, especially children and adolescents. When we think about suicide, we also have to think about what are the consequences in terms of health and the consequences even at economic levels. Health consequences of suicide, research indicates that the impact of knowing someone who died by suicide or having lived the experience personally, have attempted suicide, have had suicidal thoughts, or have been impacted by suicide is much more extensive than injury and death. People with lived experience may suffer long-term of mental health consequences ranging from anger, guilt, physical impairment, even if they were not, successful in that attempt. And depending on the means of the severity of the attempt, of course, we're looking at the severity of, the consequences. Also, survivors of a loved one are at risk, as we mentioned before. They suffer from depression. It's a trauma, and it might be a grief that resolved later on or results later on into depression and also suicidal ideations or increased risk for suicidal ideation. Economic consequences. Think about, although it's not as usually discussed, it's highly, the cost of suicide could be very high in our society. The economic toll of suicide, it's immense as well. According to conservative estimates, in 2013, suicide cost was $50.8 billion in estimated lifetime medical and work lost cost alone. Another study estimated that the total lifetime cost associated with non-fatal injuries and death caused by self-directed and violence to be around $93.5 billion in 2013. So this is very overwhelming. Think about individuals, as we mentioned before, that perhaps they were exposed to suicide through a family member, through a friend. That person suffering from depression, not being able to get out of bed, missing work, or sometimes even losing their job and causing other financial stresses as a result of dealing with a depression that hasn't been treated as a result of this exposure, even if it's a secondary exposure. Now, during COVID-19 pandemic, the societal health and economic impact of the ongoing COVID-19 pandemic is likely exacerbating suicide and mental health concerns in the United States. The American Association of Suicidology reports that in a recent survey, over 350 mobile crisis teams, crisis residential programs, and crisis call centers across the country have found that almost half, 49% of all respondents reported an increase of call volume since the onset of COVID-19. And also with at double than usual volume of crisis being reported. To help American in crisis, access suicide prevention and mental health support, the federal government has established a national suicide prevention lifeline, which can be reached through the 1-800 number posted here in the slide. But it has been discussed in the Congress the importance of coming out with a number, perhaps a 3-digit number, similar to the 911, and that is specialized just for mental health crisis situations. So the Congress finally passed this law, and we're going to have the 988 as the 3-digit number that is going to be connected for mental health crisis services. Now, even though it was approved by the Congress, it hasn't started yet. We're looking to implement the 988 3-digit by July 16, 2022. So let me ask you a question. And type on the chat, please. Why do you think that, why hasn't the 3-digit number 988 dedicated to mental health crisis started yet? Why we have to wait until July 2022? What do you think could be some of the issues that might be preventing that we launch this right away? Bureaucracy, says Clara. Yes, actually, it was sitting in Congress for a little while before they actually approved it. What else? Anybody else? Money. Yes, as part of the issue. Money, training, very good. Andres, Maria, time of waiting, because problems will come up later. Professionals, yes, Ms. Butler. Need for counselors, yes, Janet. Very good. Professionals, Sandra. Excellent. Thank you, everybody. Yes, and that's precisely what it is. The number alone is not enough. We must put in place a comprehensive, fully funded crisis response system that works for everyone. It's not just addressing the crisis, but what happens next, right? How we, able to connect those individuals to services, right? And especially when it comes to the budget part of it, because we might be connecting individuals to services who don't have health insurance. So that's part of the problem. Thank you everyone for participating. Now, when we look at the social, emotional, and mental health well-being of adolescents during the COVID-19, it's important that we look at all these different aspects. So think about when it comes to changes in routines, what are the first changes in routines that not only our youth here in the United States suffer, but worldwide? What was the first one? You could type in the chat. Social interaction, right? The school, it was abruptly interrupted, right? Families had to learn how to use the platforms for school, right? They had to learn how to use, connecting to Zoom, connecting to every school had different platforms. And sometimes within the school, they had different, for grade levels, different platforms. So coronavirus, we know that affected adolescents directly and indirectly. Beyond getting sick, many adolescents' social, emotional, and mental well-being have been impacted by the pandemic. And trauma faced at this developmental stage may have long-term consequences across their lifetime. So some of the challenges from COVID-19 for adolescents, as I mentioned, changes in routines, for example, social distancing, having to physically distance from, someone you love, like friends, a boyfriend or a girlfriend, a family member, or, even, a worship community that represents, a challenge for them. Also think about adolescents may struggle when asked to change their social routines from choosing to skip in-person gatherings to consistently wear masks in public settings. We talked about breaking continuity of learning. Schools closures due to COVID-19 have meant that adolescents have been participating in learning from home. Online platforms and communities have become essential. And as families turn to digital solutions more than ever to support students' learning, it's been very, stressful for the families. Some families not even had a computer at home or internet access. So unfortunately, the immediate need for virtual learning environments brought to light inequity in resources, as I mentioned, access and connectivity across families and communities. School closures have also meant a break in access to essential developmental services like occupational, behavioral, or speech therapy. It could also have impeded continuity in adolescents' development, for example, athletics or hands-on vocational skills, with potential impacts on their higher education and professional future. It is important to understand how virtual learning could make learning increasingly challenging for students with limited resources or special needs. Some teens may experience anxiety about going back to school in person or virtually, or some may also have experienced fatigue from online video conferencing, as we all know, Zoom fatigue. Breaking continuity of health care, parents may have avoiding seeking health care for their adolescents due to stay-home orders, and may continue to do so because they are afraid of getting sick with COVID-19. This includes important well-being, well-child visits, immunizations, also, other type of healthcare related or even mental health related services. In addition, school closures have impacted many adolescents' ability to receive mental health. Many of them, as I mentioned before, receive this type of services in the school environment. But also, think about, let's reflect, besides the family, who else, besides the family, who else is that person that it's able to notice if that particular youth is going through a mental health challenge? Teachers, right? School personnel, as they spend so much time in school, and unfortunately that hasn't been there available. So that's one of the things that we're anticipating when kids come back to school, what we're gonna find. It is important to ensure that adolescents receive the care, the continual mental health therapies that they need. Now we have very actively services through telehealth. Here at our clinic, for example, we provide telehealth services in our in-house, the Goodman Center Clinic. Another significant factor, that we have here on the slide is significant life events. For example, physical distancing can feel as, one is placed in, one life is placed on hold. The truth is that, clock keeps ticking. We have birthdays, graduations, proms, homecomings, vacation plans, birth, and also funerals, just an example of many significant life events. And in regards to funerals have been very difficult because of COVID-19. Many families haven't been able to really carry on their normal funeral rituals, which oftentimes could be a way of, receiving that support from family and friends during those difficult times. Many significant life events that adolescents may have missed, experiencing COVID-19, those are risk factors, many of what I just mentioned. Social distancing, stay-at-home orders, and limits to gathering have affected their ability to gather in person with friends, that we know how important it is during adolescence, being with the peer group, and also with the families to celebrate, or even, as I mentioned before, to grieve in typical ways. The loss of security and safety, job loss, loss of wages affected the household income of many adolescents and families during COVID-19. The economic insecurity has impacted many and has consistently, linked to adverse development in our youth, academic achievement, health outcomes. I mentioned many families lost their jobs and they have to move across town and live in very tight environments with extended families. They may affect the adolescents' ability to consistently access healthy foods, safe transportation and housing. Mounting economic stressors can increase the risk for exposure to violence as families become increasingly stressed because of job loss and insecurity in terms of their finances and uncertainty of the times in which they're living. Along with the stay-at-home orders with COVID-19, some adolescents may have been increasingly exposed to abuse and neglect, intimate partner violence at home, and sexual violence. Their increased online activity is also a risk factor, as it puts them at increased risk for online harm, such as online sexual exploitation, cyberbullying, online risk-taking behaviors. We see many of them sex texting, taking pictures that are inappropriate, exposure to potentially harmful content. It is important for parents and other pro-social adults to maintain a trustworthy relationship and open communication with adolescents, watching for behavior changes that may signal distress. As we know, adolescence could be a very vulnerable stage. And we'll talk a little bit more about that in terms of this particular stage. So now, COVID-19 on adolescents' mental health. In a survey conducted nationally from June 24 through June 30th, and this was just at the beginning of the pandemic, in 2020 to assess mental health, substance abuse, and suicidal ideation, more than a quarter of adolescents participated in the survey reported seriously considering suicide in the past 30 days. The percentage of those who had considered suicide was higher for minority groups, including Hispanics and Blacks, than it was for white respondents. I have another question, and I would like you to please type in the chat your answers. what are some of the risk factors during adolescence that might make them more vulnerable to suicide? When you remember from your psychology adolescence or your developmental psychology class, what are some of those risk factors during adolescence that make them more vulnerable? Isolation, we mentioned that. Self-esteem, issues with self-esteem. Depression, yes, Sandra. There's a high risk of depression during adolescence. Sense of self, knowing someone that committed suicide, very good, Clara. Abuse, yes. Gregoria said eating disorders. Self-esteem and family problems. Monique said history of suicide ideation. Depression, Lisette. Bullying, very good, Sandra. Excellent. Depression, yes. And very good, everybody. Thank you for participating. Substance abuse, yes, very good. Excellent. We have found that, especially in girls, depression, they tend to be more vulnerable to depression than boys during adolescence. Think about what we mentioned earlier, going through puberty, the hormonal changes, but also when it comes to adolescence, it's a type of emotional development and emotional vulnerability. Adolescence is when the first symptoms of many mental illnesses first appear. Actually, 1/2 of all chronic mental illnesses begin by the age of 14. Some of the reasons, many of you already mentioned, hormonal changes that put them more at risk of mood swings, and also the biological changes, trying to fit it in the particular peer group. The sexual orientation and gender identity during this particular stage, how successful they feel in these particular areas. Concern about their appearance, experimenting with alcohol and other drugs. Some of you mentioned that in the chat. Increased risk-taking behaviors. Increased independent may also provoke anxiety. Feel independent in terms of driving, being at a workplace where they feel anxious, perhaps learning what is expected from them in that particular job, or perhaps even moving outside the home, outside the nest, to a university far from home, learning to be on their own and being independent. That could also be triggers in terms of anxiety. Thank you, everybody, for participating. I have the chat here. Nestor, cannot see the PowerPoint. All right. So let's look at some art. These are arts that were done by adolescents who had suffered mental health challenge. And I would like you in the chat to comment on what you see here in this art. This is one was done by an adolescent suffering from a mental health illness challenge. This was a courtesy for the mental health first aid movement, and they donated their art, beautiful art. What do you see here? What is the impression you get when you see this art? And I mention this because some of you might be working in the field or you're working in the school, so they have many ways of expressing their feelings. It could be through art, it could be through writing, right, a poem, or simply just writing a note, right? So what are you seeing here? So suffering inside, very good, Vanessa said. The words in bold, yes. Progression of pain, Dr. Deepu, very good. Pressure, excellent. What else? Fragmented sense of self, right? Identity issues, very good, Yvette. Confusion, right? Pressure, very good. Confusion, excellent, very good. Suffering, tormented. Thank you, everybody. Right on point there. How about this one? Block communication, yes. What else? Identity, yes, Vanessa. Confusion, identity crisis. Feeling isolated, right? In the darkness, being hidden. Also see the hair, covering, lost, isolation. Beautiful. Shame. Very good, Monique. No identity. Excellent. Let's look at the other one. This is beautiful. How about this one? Overwhelmed. Broken. Frustration. Very good, Marietta. Low self-esteem. Desperation, right? Fractured sense of self, Lean. Very good, beautiful. Adriana says shame. Excellent. Thank you, everybody, for participating. Fragile. Yes, Mariana. Very good. Confrontation, search for identity. Thank you, everybody. Beautiful participation. Thank you. Let's talk about suicide warning signs. And this is really important because although you might heard of this in the media, it's not covered enough. Or for those of you who are mental health professionals, perhaps you had, had the opportunity to be exposed to this information in class. But there might be many from the community who don't have this information. And it's important to, go over this, and even for those who have this information to be reminded of. So suicide warning signs, you might have, adolescents or youth that might report feeling like a burden. And we saw some of this, right, represented in these pictures that we just, had the opportunity to look at from adolescents actually enduring a mental health challenge. Being isolated, increased anxiety, feeling trapped or feeling that they have this unbearable pain, increase of substance use, looking for a way to access lethal means, increased anger or rage, extreme mood swings. And in the particular case of increased mood swings, this is why it's so challenging, during this particular developmental period during adolescence, to recognize when is really, a red flag that could be indicating a mental health challenge, or even something as serious as suicidal ideation, or that could end up with suicidal ideation, actual suicide. Because we tend to see, adolescents, as part of the developmental period, experiencing extreme mood swings sometimes, right? And this could be part of these hormonal changes. However, when we see that this is something that seems to be consistent, that is a frequency, that is a duration, that it's been there now for quite some time, that we also see that it's not only at home, but it's also seen in other environments besides school, or perhaps when they are with their friends or in their particular team. So it's important that we pay attention to those different, factors. Looking or access to way to access lethal means, I mentioned that earlier, expressing hopelessness. Whether it's verbally, whether sometimes I have teachers that said, I'm very concerned about this particular student. We were in literature class and look at the essay. And the essay, it's very sad, it's very dark, and it's a cry for help. Sleeping too little or too much, talking or posting about wanting to die. And this is something that we see very frequently nowadays in the media, making plans for suicide. Now, suicide can be prevented. As we mentioned earlier, it's many systems or domains that we look at and how they are all interrelated, and that's how we need to approach suicide when it comes to the prevention, when it comes to the intervention. Like most public health problems, suicide is preventable. While progress will continue to be made in the future, evidence for numerous programs, practices, and policies currently exist, and many need to keep building up from the existing ones and improve, right? Just as suicide is not a cause by a single factor, as we mentioned earlier, the research suggests that reduction in suicide, it has to depart from strategies that are looking at all these different factors that we mentioned earlier. Suicide prevention is best achieved by focus on the individual, on the relationship, on the family, community, and the culture within that particular society across the private and the public sectors. Some of the strategies that are important to implement when we're looking at a campaign for preventing suicide. For example, strengthening economic support. Approaches for that, for example, is strengthening household financial security, so having more jobs, right, available, housing stabilization policies, strengthening access and delivery of suicide care, so coverage of mental health conditions and health insurances. We have, as I mentioned earlier, many areas, even in our state, that the availability of providers, it's very low. For example, in Florida City, it's one of those areas in our state where there's very little amount of mental health providers. We need more. And we have a high concentration, especially in Florida City, of individuals who don't have mental health services or health insurance in general. We have a high population of migrant workers who don't have access to these services, or are simply sometimes afraid to seek the service just because of their status in the country. Create protective environments, reduce access to lethal means among persons at risk of suicide, organizational policies and culture, community-based policies to reduce excessive alcohol use. For example, doing more in terms of promoting connectedness in our community, peer norm programs, community engagement activities, teach coping skills and problem-solving skills. We need to do more of that since elementary school and continue that throughout middle and high school, right? In order to help our youth to become resilient. Identify and support people at risk, especially we mentioned earlier in the schools, being that perfect arena to connect youth and family to mental health services just because of how much time they spend there and the type of relationships that they develop with their teachers, with their coaches, etc. Lessen the harms and prevent future risk. For example, self-reporting and messaging about suicide. And as we mentioned before, once we have the 988, I think that's going to be amazing in terms of really giving that importance to mental health services and reducing a stigma. It was about time, right? We've had for such a long time the 911 for medical emergencies, and it's about time we give mental health challenges the same importance that physical health has. Now, when it comes to strengthening access and delivery of suicide care, I want you to think about the coverage of mental health conditions in health insurances policies. As I mentioned before, sometimes you might have individuals who have health insurance. However, the deductibles and the co-payments are so expensive that they just simply cannot afford seeking services. Reduce provider shortages, as I mentioned before, in underserved areas. So we're able to, provide more resources to this family. Over 85 million Americans live in areas with insufficient number of mental health providers. And this shortage is particularly severe among low-income urban and rural communities, as we mentioned, Florida City being one of them. Safer suicide care through systems change. Access for health and behavioral healthcare services is critical. We mentioned that already. It's a very important, piece to this puzzle. Care should also be delivered efficiently and effectively right away. So when we mention the 988, why it hasn't been implemented, we need to have a whole system in place. So as soon as we're able to identify that person who's calling for, a mental health crisis, they're able to be connected to services right away, and we're able to continue following up with them. Take place within a system that supports suicide prevention and patient safety through strong leadership and workforce training, systematic identification and assessment of suicide risk. So think about even for youth, not only in the school and high school, but as they transition to colleges, as some of them even start working. We have, adolescents that they have their first job at the age of 16. So even having, a philosophy that is very proactive in terms of mental health in workplaces where we're able to identify when an individual might be going through a mental health challenge, and we're able to provide the support they need and connecting with services. The implementation of more evidence-based treatment of continuity of care and continuous quality of improvement. Care that is patient-centered and that promotes for quality of all patients is also critical importance. What have been done so far in terms of reducing provider shortages in underserved areas? It was recently, not many years ago, implemented a program that has been quite successful, although there's not enough research looking at the level of success of this particular program. And it's called the National Health Service Corps. And this one offers financial incentive to those who just graduating from mental health majors, okay? So it will help them to pay for their tuition, okay? So tuition remission program as you are placed in an area where it's underserved. And I believe you have to work for about 4 years in those particular area that you've been placed, and they will help you with your tuition. Telemental health services. Now with COVID-19, we were in the need of, getting training on this particular modality, and it's been proven to be very effective, especially again in reaching communities that perhaps they are far from services or providers in that particular area. So telemental health services refers to the use of telephone. It's not only video conference, but also telephone or web-based in technologies for providing psychiatric and psychological care at a distance. It can also improve access to care for patients, as we mentioned earlier, in isolated areas, as well as to reduce travel time and expenses, reduce delay in receiving care, and improve the satisfaction, and especially now many of us who are in isolation, being able to connect with others. A systematic review of the telemental health services found that services rated as high as good quality were effective in treating mental health conditions such as depression, schizophrenia, substance abuse. They have proven to be very effective. We mentioned earlier about perhaps the importance of teaching coping skills and problem-solving skills as early as in elementary school, right? And continue doing so through our middle and high school to be able to give our students, our youth, the ability to be resilient. We're not exempt, right, of problems. We're all passengers in the train of life. We're exposed to, different situations. Look what happened during the pandemic. How many of us have been exposed to, very serious situations that has triggered, depression and anxiety, and having, good coping skills give you the resilience and the strength to overcome these challenges. So building life skills prepares individuals to successfully tackle everyday challenges, as the one that we are going through right now due to COVID-19. The inability to employ adequate strategies to cope with immediate stressors or identify and find solutions for problems have been characterized among suicide attempters. So that's why, as a way of prevention, we should include in our homes, and especially in schools, in the curriculum, teaching coping and problem-solving skills to our children and youth. Approaches to teaching coping and problem-solving skills, in a broad sense, social-emotional learning programs in the schools, and parenting skills and family relation programs also. Especially if an individual or youth has already been identified as suffering from a mental health challenge or illness such as depression or anxiety, or some sort of traumatic experience that we know could be a risk factor for suicide, those families should receive services that give caregivers the support they need to strengthen their parenting skills, and also enhance positive child interactions, as this could be a protective factor. Now, the social emotional learning program focuses on developing and strengthening communication and problem-solving skills and emotional regulation, conflict resolution, and help-seeking and coping skills. So these are very essential as a preventive way, and also as, if we want to call it, a level 1 intervention as well. Identifying people at risk. In order to decrease suicide, and it's important that we pay attention to vulnerable populations, okay? As these groups that tend to experience suicidal behavior higher than average rate. We mentioned some of this population, for example, we said youth, adolescents, but we also mentioned perhaps earlier the veterans, right? And certain subgroups within adolescents, we mentioned Hispanics and Black populations. So such vulnerable populations include, but are not limited to, individuals with lower socioeconomic status, or those who are living with a mental health problem, people who have previously attempted suicide, veterans and active duty military personnel. Remember that they have families, and these families have exposed to their mental illness, and this could be risk factors for the youth that are part of these families. Individuals who have been institutionalized or have been victims of violence or exposed to trauma. Think about how many of our adolescents have been exposed to trauma in their own family of origin now through the pandemic. Individuals with sexual minority status, as we mentioned before, and other members of certain racial, ethnic minority groups, as was mentioned before, Hispanics and Blacks, shown in surveys that were conducted early in the pandemic as very high percentages reporting suicidal ideation. Efforts for supporting those at risk, for example, gatekeeper training. The gatekeeper training, it's a type of intervention skills or training that is widely implemented, and it helps hotline counselors, for example, and emergency workers and other gatekeepers to identify and connect with suicidal individuals, to decrease, de-escalate the crisis that they might be going through, understand the reasoning for living and dying, and assist with safely connecting those in need to available resources. Crisis intervention, it's another one, and one of the trainings focused on suicide prevention hotlines are one way to provide crisis intervention. For example, an evaluation of the effectiveness on the National Suicide Prevention Lifeline to prevent suicide, researchers also found that among follow-up participants, there was a significant decrease in psychological pain, hopelessness, and intent to die between initiation of the call and when there was an opportunity for those counselors in the hotline to follow up. Treatment for people at risk of suicide, the improving mood-promoting access to collaborative treatment. That's a program that aims to prevent suicide. And this particular program, and the abbreviation is called IMPACT. This program facilitates the development of a therapeutic alliance and a personalized treatment plan that includes patient preferences, as well as proactive follow-up, as close as biweekly, for example, during an acute phase especially. And as they get better, they might transition into monthly as they continue, to being connected with this family or a person who's at risk of suicide. And they also get assigned a depression care manager that continues to follow up with them over the phone or with home visits even. I wanted to finish this presentation with another art from an adolescent who experienced a mental health challenge and was able to get better, feel better. It was able to get the help that she needed. And this is a drawing expressing precisely that. So I want to hear your comments on the chat when you look at this particular drawing, what you see. And it says, the caterpillar thought her life was hard, then she began to fly. So we see hope, liberation, free, shows hope. Very good, Maria. Freedom. She saw hope, light. Very good. Right? And especially when we think about caterpillars, right? Going into the dark and then coming out as beautiful butterflies, right? Coming out of that darkness. Diversity, very good. New perspective, Miguel, thank you. Sandra, being open, joy, transformation. And that's precisely why it's so important when we do prevention work. And the importance of doing prevention work with youth is to help them navigate throughout that difficult, and dark period, and see that there is actually light, that there's a chance for living a new and authentic life, right? And being able to see, as Marietta says, that light at the end of the tunnel, right? And having a new life. And that's precisely why we do this mental health awareness events. And it's to continue to raise an awareness in our community and be able to reduce the stigma. And have you ever wondered why the color of the Mental Health Awareness Month is green? Anybody? Do you know? Very good, Jenith. Hope, new beginnings, right? New beginnings, hope. Thank you, everybody. You've been great participants. Thank you.
Thank you, Professor Lescano.
Thank you for having me.
Absolutely. Very much enjoyable. So, once again, let me see if I can get my camera to work, and I am on.
There you are. So, David, before we present our next speaker, I also wanted to acknowledge the presence and support of our Chancellor, Dr. Hiroki Wu, who is in our audience. For those of you who joined us late, I'm Dr. Barroso, Director of the Master's Programs in Psychology. I welcome again those students, faculty, field supervisors, guests who joined us a bit late. We have Professor Lescano. Dr. Diaz here has organized again a wonderful mental health awareness week.
I don't know if it's just me or we lost audio.
Alvarez was experiencing a personal emergency. He was unable to join us. And as a result, I reached out to Dr. Turgeman to see if he could assist. I mean, he has vast knowledge in neurology, and this is what I want to state. Without hesitation, he rearranged his schedule, and he said, sure. So not only do I want to acknowledge his collegiality, but his generosity and selflessness. So Dr. T, thank you so very much. Truly grateful. Now, Dr. Turgeman is going to be presenting on acute chronic effect of COVID-19 on neurological function. And he is currently working now with Nestor to upload his PowerPoint presentations. And he will be signing in. He's actually in the actual course itself.
Coming here?
Take a look to see if he's made moderator. And I don't see him in here just yet.
Dr. Diaz, while we wait, let me give a couple of reminders to the audience. We have put in the chat box the evaluation form link, and we will refresh that every so often. I remind all of you that it is important that you fill out continuing education credits for your licenses. Your credits will be directly uploaded to CD Broker. We can also issue a certificate of attendance. Certificates of attendance can also be issued to students and alumni. While we will take questions continuously in the chat box, we will also provide a question and answer section at the end of the event for any other leftover questions that you can either write in or turn on your microphone at that point and ask the questions. Thank you. How are we doing, Dr. Diaz? Dr.
Yeah, so
Torreman, ready.
I want to go ahead and introduce Dr. Turgerman. I just received a text. He's trying to connect. Apparently he's having a little bit of connectivity issues. But in the meantime, I'll tell you a little bit about Dr. Turgerman. So Dr. Turgerman is a full-time faculty at Albizu University, and he is the co-coordinator of the Neuropsychology Chapter, faculty advisor for the Neuropsychology Club. So classes in which Dr. Turgerman each include assessment of intelligence, advanced treatment as well. He's also an adjunct faculty for the Masters in Speech Pathology program. And he's been featured as a guest speaker at the South Florida Research Symposium, the Estee Lauder Mental Health Week, which is kind of cool, and Criminal Justice Symposium at FNU. And he's presented at multiple conferences and has co-authored books, chapters, and publications. His research interests center around the study of neuropsychological aspects of acquired brain injuries, including concussions. And so currently, Dr. Turgerman is primary investigator for a study exploring the pre-morbid and comorbid factors that influence neuropsychological status in patients diagnosed with acquired brain injuries. In addition, because yes, there's more, he is also co-investigator for a multi-center study that features group cognitive rehabilitation with individuals diagnosed with MCI or dementia, as well as being a certified clinical rater and sub-investigator for a multi-center I can't speak right now, pharmaceutical study. All right, so let me just check in with Dr. T to see, and apparently he's having somewhat
and disinformation out there on social media. Hello? It looks like we're getting feedback from Nestor.
Nestor, can you assist?
Nestor, can you kindly assist?
Hello? Okay. Okay, I think it's a little better.
Yes, it is.
Okay, we're okay. Yeah, I knew because when I muted myself, the sounds went away. Okay, so let's see, where was I? So in the case of COVID, the risks of waiting to share the vaccination message can be quite severe. And I just want you to remember that public health is what we all collectively do together to protect the health of everyone within our communities. And so the, opposers to vaccination are all over social media. So we need to be there present on social media as well to promote vaccination and save lives. And what's nice is that as a result of the COVID pandemic, there's more funding now for research into developing more meaningful, trusted, and influential communication strategies. Okay, so for this next part, Daricel and I will engage in a role play. And let me see, I lost some of my controls. I lost some of my things on my screen. So hold on just a second.
Nestor?
Okay, so now I can do slideshow again.
Dr. Pace, maybe you can use the arrows on your keyboard.
Yeah, it's just, oh, you're right. I probably could have. I'm just trying to rearrange things. Okay, I've got it. I've got it now. So, yeah, to kind of, I know everybody's going to have been sitting here listening to us. So we wanted to do a role play. We thought that would be really neat. That's something that I actually do with my students. And so I have a lot of ground to cover tonight. So this role play may include more specifics than you might see in a typical vaccine conversation. And the setting is a Zoom call. So I'll be playing a faculty member at the university, and then Daricel will be a student in my class. And it's really, it's any university. Okay. So I'll let Daricel go.
Okay. Hi, Dr. Chase.
Hi, Daricel. So good to hear from you.
Good to see you. I'm reaching out because I want to ask you some questions about this coronavirus vaccine. I'm still undecided on whether I should get it. I just feel overwhelmed with everything that I've been hearing about it lately, and I'm not sure if it's a good idea for me to get a vaccine.
I'm so happy that you reached out to me. I would be happy to answer any questions that you have. May I also share some information about the COVID vaccine?
Yes, I would like more information to clarify some things. I'm worried because of how fast these vaccines were developed. I thought that vaccines took years to develop. Therefore, they can't be safe if the process was.
You are right, Daricel. Traditionally, it has taken many years to develop a vaccine. However, the timeline has been substantially shortened for COVID-19 vaccines. This is because we were able to use pre-existing vaccine platforms, and there was substantial funding to run multiple trials at once and scale up the vaccine manufacturing. At no point were there any shortcuts in the science behind vaccine development. The COVID-19 vaccine trials went through the same regulatory review, and there was much more transparency. Typically, the drug companies don't publish their trials, and in this case, everything is out there for the public to view. So I believe that you can feel very comfortable with the safety and efficacy of these vaccines. And if you're interested, I can forward you the published clinical trial outcomes for the currently available COVID-19 vaccines.
Yes, that would be actually very wonderful. But what if I have one of those allergic reactions to the vaccine?
So I see that you're concerned about some of the adverse events related to vaccination. Allergic reactions to a component of any vaccine are uncommon, and they are treatable at the time of vaccination. I like to focus on the benefits of vaccination. The significant number of COVID cases, hospitalizations, and even deaths that have been prevented far outweigh the 3 in a million chance of developing a severe allergic reaction to the vaccine. The CDC and vaccine developers take vaccine safety very seriously, and the fact sheet that you receive when you go to get a vaccine describes the potential side effects so that you can make an informed decision. I'd be happy to share the fact sheets with you and some articles that provide more information about adverse events.
Thank you so much. That will be very helpful. I have one more question. Why should someone like myself, who is young and healthy, be vaccinated? I read that most COVID-19 infections in young people are asymptomatic or mild. Isn't a natural immunity better?
That's a great question. The likelihood that young people like yourself will develop severe COVID-19 vaccine is low, but the long-term consequences of an infection can be very serious. Also, perfectly healthy young people have had very difficult courses with this disease. And a significant number of young people with asymptomatic or even mild infections are developing what we call Postcovid Syndrome. You may have also heard it referred to as long COVID. Long COVID symptoms can include fatigue, a cough that won't go away, memory loss, anxiety, and even depression. The problem with not getting vaccinated is that a natural infection carries with it a risk of serious illness, prolonged symptoms, and even death. The benefits of vaccination far outweigh the risks of not being vaccinated.
Thank you so much for all this information. I will look over what you sent me. Is it okay for me to reach out with any other concerns that I'm?
Absolutely, Darisel. Please contact me anytime, and be careful to verify your sources. There's a lot of misinformation and even disinformation out there. The problem with disinformation is that it is spread deliberately to deceive people. My go-to resource to find out information about vaccines is the website cdc.gov. Now, let me ask you a question. What is your why for getting vaccinated?
Well, now with this information, I do want to protect my long-term health and be able to spend time with my family without having to worry that I will give them like COVID-19 or COVID. I also, some of my friends have the same concerns I had, and I will make sure to share these resources and information with them. So thank you very much, Dr. Chase.
Thank you, Darisel. Thank you so much for reaching out. Okay, so that concludes our role play, and Darisel will come back at the end and join us. So, as we saw from the vaccine study that I just showed, it's really important that you're able to talk to your friends and family about vaccines. Your conversation might not look as detailed as the conversation that we just had, but I kind of wanted to cover some ground with the conversation. But the concern about vaccines, and especially the COVID vaccines, with all of the media attention and the misinformation out there, is that it can be another stress on top of the stress of working from home and social isolation. So thank you to Dr. Lescano for speaking to us about the effects of anxiety, stress, and isolation. It's important that your vaccine message is geared towards the health literacy of the person you're talking to. I knew that was a student I was talking to, and that whatever I sent them, they would be able to interpret. And in the classroom, I have my students do a role play of the vaccination conversation with a mock patient, where one student plays the clinician, the other student plays the patient, and then they switch. So the role play you just saw kind of resembles the type of tough questions they would get from their peers. And I've had vaccine conversations with so many different people, and some people who are very vaccine hesitant and are extremely well versed in what's some of these books written by people who don't believe in vaccines, and they tend to believe what they read. And so what I always just try to, what I think you should do is you should always talk about the risks, because you're not going to change somebody's mind by telling them how great the science is, especially somebody that doesn't trust the science, or they don't trust the healthcare system, they don't trust the government, they don't trust the drug companies. So you kind of want to leave that out and just talk about how important it is that they protect their health. Okay, so now we can get into the trust. So you don't just need safety and efficacy with vaccines, you need trust. So the image on the left is the ideal public health image of what a vaccine acceptance should look like, where everyone is accepting of vaccines, especially the COVID vaccines, who are able to protect everybody in our community and then generate the herd immunity. So we can stop the spread of the virus. Okay, the image on the right is actually what sometimes the vaccines looks like in the minds of individuals, because they know that there was an accelerated process by which they developed the vaccine. So they might think, they might not trust it because of that. So just to get into a little bit of history about it. Operation Warp Speed was announced in May of 2020. That was the name of the Department of Defense initiative to accelerate the vaccine process to get a life-saving vaccine in the hands of the public. The government assured us that they would distribute safe and effective vaccines, and they did. But the accelerated aspect of generating life-saving vaccines overshadowed their public health intent. There can be distrust in the government and the healthcare system. And then the only way to overcome those things is through effective communication. And I definitely want to add that the vaccines are safe. Before the pandemic, I used to talk to my students about the inactive ingredients in vaccines. So all of the ingredients in the vaccines are used in other licensed vaccines. So the technology was there. That's how we were able to bring a vaccine to approval so quickly. And we know that there's been a huge magnifying glass by the media, and just all of the scientific journals have published all of the data from the clinical trials. So there's much more transparency. The mRNA vaccine technology, that was even there. There have been other clinical trials for influenza, rabies, and Zika based on the mRNA vaccines. And then I just want to say something about the funding. There was so much funding that once they were able to run all the multiple clinical trials, but then when it came down to making the vaccine, that's what cost the vaccine producers so much money. But because they had the money, they actually started manufacturing these vaccines before they even got approval. So when they did get approval, because they showed the vaccine was safe and effective, then they were like already made, and so there were just things that were put into place that allowed the vaccines to be available so quickly. And one of the other things that I wanted to mention is that because there was a pandemic, there were infections galore. So it was really easy to test the vaccines. Typically, it's difficult because you have to test the vaccines in a population where there's a lot of infections. So with COVID, because there were so many infections, they were just able to do that really quickly. Okay, so I always like to talk about risk-benefit communication. I think that is very important. It's important that everyone sees the risks of not being vaccinated. So on the left here, it looks like my pointer is working. You see the vaccine side effects. So up to 50% of vaccinees experience fatigue, headache, chills, muscle and joint pain. Up to 15% may experience fever or diarrhea. Some don't have any symptoms at all. Okay, and then the very rare adverse events don't even show up on this graph because they are so rare. And then when we look at the risks of infection, and this graph was for another vaccine, but I kind of put the COVID percentages in there. In 80% of cases, you'll just have mild infection with very basic clinical intervention. In 30 to 40% of cases, you have patients developing this post-COVID syndrome, or what's also known as long COVID. And then in 15% of cases, patients need oxygen therapy, 5% they need mechanical ventilation, and 1% actually go on and die from the infection. Now, these numbers, this is just in the US. So you can imagine in countries that just don't have adequate access to oxygen, or they don't have access to mechanical ventilators, that these percents are even higher. Okay, so this is actually a time-lapse video. This is showing lung scans from a 50-year-old, and the damage caused by COVID-19 is shown in red. So that red improves with time, but many patients have long-lasting respiratory symptoms. And also they're showing that about 1 in 3 COVID survivors suffer from mental health conditions. So the risk of developing this post-COVID syndrome is even higher in patients who've had moderate to severe disease. Okay, so I wanted to take a moment and talk about vaccine metaphors, because that's some of what my scholarship is about, what I publish on. In the classroom, I have the students come up with their own vaccine metaphors. A vaccine metaphor is it should be a thing. It's analogous to a vaccine and exhibits qualities that a vaccine does. So vaccine metaphors can be used in the vaccination conversation to connect with the experience of the person you're talking to. I didn't end up using my vaccine metaphor. I have one that I developed. So whenever I have my students develop one, I always tell them mine first, and then I have them develop their own. One of my students likened vaccines to a scouting report of a rival football team. The home team or the vaccine can use the scouting information to anticipate the strategies that the rival team or the virus would adopt in the upcoming game. And more than one student has proposed thinking of vaccines as the armor of a knight going into battle. And this is really important, especially if you're talking to somebody that might not understand what an antibody is, or they don't know when we say it, it protects your immune system against the virus, or it makes you immune to the virus. They might not know what that means. So that's why it's so important to connect with somebody's experience through these vaccine metaphors. And recently I came across an interview with Dr. Fauci in which he spoke of a metaphor for coronavirus. So I really want to show you that. And I'm not sure if you're going to be able to hear the sound, but I did put on the closed captioning. So if you can't hear it, then you'll at least be able to read it. And it's only a minute. That's where he talks about the metaphor.
Dr. Chase, maybe turn on the volume on your computer.
I have it up. I can pause. I'm not sure because I know how to share on Zoom, but I don't know how to share volume on the Blackboard Collaborate. But anyways, he talked about his metaphor. So he's comparing the virus, saying that his metaphor that he likes to use is that, this virus has adapted itself to people, and that it's perfectly adapted because it doesn't kill all of its hosts. So that it can still spread. And let me see, there's a couple more things he says.
As much as I possibly can.
We can also read the closed caption.
Yeah. Okay. That's it. Let me see if I'll put it in the chat, just if you want to look at it later, because the chat, it will. Anyway, it was funny because after that, he was on that pandemic thing, my colleague who I did the vaccine metaphor study with, he wrote to me and said, "Oh my gosh, Anthony Fauci was talking about a metaphor." But yeah, his, because it's a pretty smart virus, especially being a respiratory virus. Okay, that's the link to the video. So we are seeing data that shows trust in COVID vaccines is growing. This was a survey done in November 2020 and then again in January of 2021. So in November of 2020, when they asked people if they would take the COVID vaccine if it were offered this week, there was about 40% that agreed or strongly agreed that they would get the vaccine. But then that percent went up to 50% the fall, maybe a couple months later. And then in terms of being worried about the side effects, there were about over 50% worried, and now there's less in January 2021. So it's it is working, and that there's been hopefully the communication strategies by the countries are reaching people that might be hesitant about getting the vaccine. Okay, so I'm glad I'm showing these because we might still hear from our other speaker, and I'm almost finishing up here. But so I don't want to venture too much into the topic, except to make you aware that there's been some very interesting discussion on the subject of COVID-19 for people with severe mental illness. And this is because this population is at an increased risk of being infected by COVID-19 and has higher rates of hospitalization, morbidity, and mortality. Also, people with severe mental illness have reduced access to preventative care. We know that. So there's already low uptake of vaccines that they scheduled to get And so it's really crucial that our vaccination communication strategies reach this vulnerable population. And it's a pretty hot topic right now. So I just really quick want to go through safety and immunogenicity. I don't like giving a talk without getting into safety. Just to go over the phase 1 and 2 trials are conducted to with the primary objective of safety, and then they also at the same time gather information on the immunogenicity of the vaccine. So any problem that happens after vaccination is considered an adverse event. An adverse event can be a true adverse reaction, like we know, you know, that even though it's extremely rare, we do know that anaphylaxis is an adverse event for the Moderna and the Pfizer mRNA vaccines because of the nanoparticle technology. Okay, and so so the people that are allergic to those vaccines, even though it's like 2.5 to 4 in a million cases of vaccination, they've also possibly been allergic to other drugs that contain it's the polyethylene glycol. It's the same thing that's in Miralax, right? The thing that you take for constipation. So so it's not like there's some novel ingredient that doesn't show up in other drugs and vaccines, but it is a contraindication to future vaccination. So if anyone has had an allergic reaction to a vaccine, then they shouldn't. Then they should look at the ingredients and say, okay, I had a reaction to this vaccine, and this other vaccine has the same ingredient, so I shouldn't get that vaccine. That's a true adverse reaction. It's a true contraindication. But there's also adverse events that's a coincidental event that just happened following vaccination but isn't related to the vaccine. So I can go get a vaccine and then, you know, I might, I don't know, have some sort of health event a week later. Then that still gets reported as an adverse event. So I think that's what's so confusing to some of the people that are following the reporting of adverse events, is that they believe that it's related to the vaccine. Okay, and then just to get into the immunogenicity, it's just the capacity of a vaccine to induce an immune response, which is typically measured by the production of antibodies. And then for vaccine efficacy, this is the primary objective in a phase 3 clinical trial. So all of the vaccines that reported their efficacy, they did so after the phase 3. And the coronavirus vaccines went through all phases of the clinical trials, and they demonstrated safety and efficacy before they were approved. And then the durability is just how long you're protected and how long your immune memory to the virus lasts. Just to make a point that we don't know how long these coronavirus vaccines will last, because it was, you know, we just don't have enough data yet. And so we don't know how long the antibodies will last. We know that people are generating neutralizing antibodies. We hope it's over a year. But I know that some of the vaccine producers have come out and said, you might have to get another vaccine in a year. Okay, and then all of this vaccine safety is being monitored by the Vaccine Adverse Event Reporting System, which is our national vaccine surveillance program, and they're following up on any adverse events that are reported. So anybody can go on this system and they can report an adverse event. There's a form you fill out. Physicians typically fill these forms out as well. Then what I thought was really cool is that the CDC has this fee-safe, and they didn't have this previously. This is something new. And it's on, so it's something you put on your smartphone. And so as soon as you get vaccinated, then you go in and you tell them if you've had any side effects, but it checks in with you weekly. And I put it on my phone, so it, like, every week I get a reminder and it says, you know, let us know if anything's happened. So I think they're really This is from the CDC. They're really following, what's going on with the vaccines and the adverse events. So we can be assured that the magnifying lens are on these vaccines. And then so I'll go through just some communication pearls and then I'll follow up. I put some extra slides in, but it's not necessary. If there's anything else you want to know, you just feel free to email me. So I just wanted to summarize the communication piece because this is what's so important and why I'm here talking to you. So there's just some communication pearls. So I always ask open-ended questions. They're meant to elicit more than a yes or no answer. And it also kind of gauges what you kind of get a feeling of what a person knows. And this is something that we didn't do so much in our role play, where I kind of went in kind of knowing what Daddy Cell knew, but it is a good strategy to use. And then you want to ask to share information. So I did that in the role play. And then you want to tell. So once you're given the okay to share, then you tell, and then you ask again. So you want to always check for understanding. So you might say things like, tell me what you learned about COVID vaccines, or tell me what you know about like after you tell, kind of then see, did they understand what I just told them? Okay. And because you really have to meet people at their health literacy level. So help them find their why to getting vaccinated, which I asked Daddy, so why do you want to get vaccinated? This is super important. And then if you can help them make their vaccination happen, you should do that. If you can drive somebody to the vaccine appointment or you can make their appointment online, then you should definitely do that. Okay, so then I'm just going to, let's see, just skip forward. Well, I have to say really quick that I can't skip this. So in contraindications to any vaccination is anaphylaxis, and then live vaccines shouldn't be given to pregnant or anybody that's immunocompromised, but none of the COVID vaccines contain live virus. So this is one of the misconceptions out there, that I'm going to give somebody COVID-19 if I get the vaccine, but it doesn't contain live virus. It just contains the protein that helps your body develop antibodies against the protein. So pregnant people, anybody who's pregnant can get the vaccine. Anybody that's immunocompromised by any sort of treatment or an autoimmune disease can actually get all of the COVID-19 vaccines that are available in the US. Okay, so this is what I'm talking about, just some of the misinformation that you'll come across out there. And then I just to kind of, so I don't go too much over, I just want to thank the organizers from the Albizu University Masters in Psychology programs for putting on such an important event. I'd also like to thank my own NSU community with the learning environment to work with students on effective vaccination communication. Yeah, just to remind everybody that public health is what we all collectively do together to protect the health of everyone in our community. So if just to all of the students out there, talk to friends and family, become knowledgeable, watch out for misinformation. We need you out there sharing the vaccination piece. We can't wait until somebody speaks with.
By our students. The first one is, what about FDA approval for these vaccines? Is it expected? Let's see, is it expected to happen sometime this year?
Sorry, I don't know how to, let me see. I'm trying to figure out how to stop sharing. Oh, stop sharing.
That-
Right there.
there's
Okay.
a little toggle. There you go. So just to repeat the question, what about FDA approval for these vaccines? And is it expected to happen sometimes this year?
So the FDA has approved emergency authorization use for the COVID-19 vaccines. All of at least the 3 that are available in the U.S. So in terms of, I really don't know how to answer that question because I just don't. I know that they have to go through a certain amount of time post clinical trials, just kind of collecting information when the vaccine is actually being used. So just to look at adverse events, but as far as I'm concerned, it's approved based on what they would approve other vaccines for.
Okay. Thank you. There's one more question. It says, after you take the first vaccine, how many days would you experience the side effects? And are there studies about that? Or does it depend on the individual?
So generally the side effects are your immune system responding to the virus. That's why when you get that second Moderna shot or the second Pfizer shot, the side effects are worse, and nobody wants to go get their second shot because they hear, oh my gosh, somebody had a fever, chills, and they felt horrible. They had fatigue, they missed work. And it's because of just the fact that it's stimulating your immune response. So to me, if I have those things happen, I get a fever or I feel fatigue, I'm like, oh, that's good. It's working. It's helping my immune system. So I typically, from what I hear, it's only a few days post vaccination, and that you shouldn't have any other symptoms like fever and chills at least a week out, because you might have muscle joint pain for a while. I know I had a lot of pain in my arm, but I think it's because they vaccinated me higher and not directly in my muscle, and so I had a lot of pain just for 3 days. But I think it should go away pretty soon, and you shouldn't expect anything else. And I haven't heard of any long-lasting side effects from the vaccines.
Awesome. Thank you so much. Are there any other questions? If not, I'm going to go ahead and turn it back over to Daricel.
Yes, thank you. So I just wanted to share a little bit about my experience with vaccines. So when we first started to get access to vaccines, I was hesitant to get it. And many of my own fears, they came from a place of misunderstanding and not really having enough information about the process and benefits for my own health. And then I came across on Instagram, an Instagram page of this doctor. Her name is Risa Hoshino. I can share with you guys her page. If you do have an Instagram, she's a very good resource. So she's a pediatrician and she's specialized in public health. And she basically explained many of the great points that were addressed today by Dr. Chase in her presentation. And they were further reinforced by the information that I received at school. And I think both of them empower me with having a better understanding. And then once my peers, when they began to get vaccinated, we talk about their experience with the vaccination process and the side effects, and also why it was important for us to be vaccinated. And so then having both reliable information and also my friends' input on vaccine really helped me to make the decision to get my vaccine. So I think this is why it's so important to have reliable information, as it empowers instead of installing fear. And fear can lead us to risk our own health and that of our family for something that is preventable with just 1 shot or 2 shots. And yeah, I just wanted to share that. And I would put Dr. Risa Hoshino, her Instagram page in the chat. And thank you again so much for having us today here to talk about this very important topic. Thank you.
Thank you so much, Daricel, for coming on board with Dr. Chase and his I really thank you also for sharing your experience, because this is exactly what she said that we needed to do, right? Share our experiences and speak within our social network. So thank you, and thank you also, Dr. Chase.
Thank you so much.
Yes, I wanted to thank both speakers for sharing not only the knowledge, but also their personal experiences with the viruses and personal feelings. Our next presenter, okay, is just waiting by the sideline to come on board, and Dr. Turgeman, who I introduced earlier, and he's going to be presenting on acute and chronic.
So we're live? I can't hear her.
Can you hear now?
Oh, yes, now I can hear.
Oh, wonderful. All right. I just wanted you to know that we were introduced prior, but I want you to hear that how much we appreciate you stepping in at the last minute. And I emphasize not only to the audience, but also fellow presenters, how grateful I am for your collegiality and generosity and selflessness. So thank you again.
Well, my pleasure. Glad to be here. And I think that this is a very important topic to discuss. So thank you for the invitation. So I guess we can go ahead and begin. All right, so my topic is on the acute and chronic effects of COVID-19 on neurological function. So basically what I did in preparation for this topic was do a literature search of current reviews regarding neurological sequelae as well as neuropsychological consequences to the disease. But before we begin, I wanted to give a brief history or just introduce myself a little bit more. I am a clinical neuropsychologist by trade. I'm an assistant professor here at Albizu University. Staff psychologist at Design Neuroscience as well as Kendall Regional Medical Center, and a certified brain injury specialist. I do not have any disclosures to declare, so this is just done, for the fun of it. But I did want to put this up there because it does give me kind of a different look at the presentation of COVID-19. So with my clinical experience, I have had several patients that have gone through the presentation of having COVID-19, and I've had a chance to see it in the post-acute phase. Once, obviously, the stabilization with the critical initial presentation, I've had patients that I have been following before, as well as new patients that I've seen in the hospital. And so I've had a different experience in regards to that, because my role typically is to assess things like cognition, emotional stability. And as we've seen throughout this past year, and as the presenters have talked about, this has been a very unique experience for all of us. Also, I just want to briefly share that aside from being a clinician, I have also been personally impacted by this, losing someone that was close to me due to this disorder. So I've had the chance to experience this not just as a clinician and health provider, but also as a family member during the mourning process. So it gives a unique point of view. So I kind of wanted to start about what is the experience. So when we talk about neurological health and neuropsychological health, we usually just focus on the brain itself. And obviously, that's going to be a focal point of this presentation, but we have to consider the brain as a holistic manifestation of us. So it's not just the organ itself, but it's everything that we experience, the environment, our interactions, our emotional status. So all this factors into our brain health. So this is an image that I got from Google search, and basically it depicts an image that was all too common during the midst of this pandemic, when it was at its most acute phase, which is of a patient in a hospital bed with a lot of tubes and alone in isolation. So if you consider what typical hospital presentations are, it already has a lot of sterile aspects to it. And the notion of being hooked up to machines, being seen by basically strangers, and undergoing a life-changing event. Well, coupled with that is the notion that a lot of patients went through that alone, unable to see or even hear from their loved ones, and oftentimes being treated by individuals that you weren't even able to see their faces. So these are actually a couple of physicians that went on to put pictures of their faces as a way to communicate or at least show the patients who they are, give them a sense of familiarity, but still wearing protective gear does create a significant level of separation. Obviously, this is done for safety reasons, but you tag on to that everything that's going on, all the psychological consequences of going through the process, not just in isolation, but in separation amidst everything else that the patient's going through. So that in itself will have neurological consequences, because I always tell my students that when we look at the idea of what makes us who we are, and there's always the argument of nature versus nurture, but I go back to something that one of my first supervisors in research told me, that it's both. It's 100% both. That we come into this world with genes and a certain predisposition that is activated by the environment. It's those experiences along with our nature is what makes us who we are. So it's important to consider that it's not just the viral infection, but everything else that happens around it that will shape what we see with neurological health moving forward. I also wanted to briefly show images of what it looked like as far as how expansive this became with gyms and convention centers being turned into hospital units. So again, when we talk about the neurology and the neuroanatomy associated with COVID-19, we have to talk about it in context. We can't leave out all the other components that went along with this. So let me move forward. The first thing I want to discuss is this notion of the ACE2 receptors. So we've learned that these receptors are basically all over the body, very, very prevalent in the tissues in our nasal passages, our lungs, which is why the virus is so prevalent in those areas, but it also is in other areas of the body. Well, it just so happens that it's also in our brain. And here I have depicted in the slide from the study shown there at the bottom, some of the most prevalent areas in our brain. So we're talking about that the virus itself has receptor sites in the brain tissue itself, manifesting in such as on the top part right there, you see our motor strip, where motor strip is associated with motor function as the name depicts, but also the substantia nigra. And the substantia nigra, we've come to know that area of the brain because it's very much associated with Parkinsonian symptoms and Parkinson's. So whenever that area of the brain becomes affected, we get a depletion in dopamine, which onsets a lot of the Parkinson symptoms that we see manifest in our patients. The temporal lobe, the cingulate gyrus, all these areas have these ACE2 receptors. Now, as a brief aside, the ACE2 receptors, when they are basically interacted by this virus, it inhibits them from doing what they typically do, which is being part of a lot of our metabolic processes associated with everything with the regulation of blood pressure and other vital everyday activities. But this is part of the reason that we get into this catastrophic inflammatory process that affects multiple organs. But as you can see from this slide, it's not even the indirect effects, but the direct effects of the virus with the receptor sites scattered all throughout our brain. Let me see, I skipped the slide. And these two slides taken from the same study also show means of infection as far as how the virus itself can latch onto these receptor sites in the brain. The most typical is the nasal passage. Now, we know that loss of smell, it has been very, very much associated with COVID-19. But one thing that we should also be aware of is that our olfactory sense, our sense of smell, is actually one of our more stronger senses, although we as humans oftentimes don't really pay much attention to it. We usually focus on vision and hearing, but olfaction is very, very potent simply because this is where our nerves are actually exposed to the atmosphere, obviously within our nose, but those nerves are exposed to the atmosphere and then go directly into the primary areas of the brain in which they're processed. Typically, our senses go through a relay system, the thalamus, but not the olfactory sense. So it's a very, very potent sense in our body. So knowing that, this presents a highway for the virus to actually find a way into our brain. The next way is this blood-brain barrier. The blood-brain barrier is basically a way to keep pathogens outside of our brain. Now, that doesn't necessarily mean that blood isn't circulating throughout our brain, but there is a means of separation. Direct exposure to blood can potentially be toxic to tissue. But this virus has also found ways to counteract that. As you can see depicted there on the image, it is able to bypass this. Again, making it a very, very potent virus, leading to the potential of neurological deficits. So here I've collected certain snippets from a few studies I looked at. Going back to the initial study I talked about, aspects such as the contributions of invasive mechanical ventilation, sedation, and psychiatric symptoms can lead to complications in ICU. This has to be considered when looking at neurological functioning. So we've talked about the direct aspects of the virus. We've talked about some of the environmental aspects, but also the secondary aspects of having this disease. So if you were exposed to it and obviously had a more severe course that required ventilation, that in itself can potentially cause significant neuronal changes. Obviously, we have the ventilation there so the patient can continue to get oxygenation, but there can be instances of hypoxia if saturation dips before a certain threshold. In our patients, we like to see them above 90, but there's been instances where saturation really, really goes below to critical levels, which is why we ventilate. Sedation. With sedation, there's always a risk that there's going to be some level of neurological consequences. In life-threatening situations, we need sedation in order to do things such as ventilation, but it has that risk factor associated. Encephalopathy, agitation, confusion, and cortical spinal tract signs were all associated with our ARDS, Acute Respiratory Distress Syndrome, due to the COVID-19, the SARS-CoV-2 infection. So encephalopathy is basically I would say a negative reaction in your brain, usually caused by or resulting in inflammation, but it's a pathogenic process in the brain. And agitation, confusion, those are some of the psychiatric manifestations that we can see. And our cortical spinal tract is basically what allows us to have motor function. It's the tracts that come from our brain down to our spinal cord and eventually extend to our periphery to give us the ability to move and so forth. And finally, furthermore, 33% of discharged patients demonstrated inattention, disorientation, or disorganized movements upon command. So once they were discharged, meaning that the acute phase and potentially subacute phases had subsided, there was this prolonged neurological effect found in this study. All right, so in severe and persistent cognitive dysfunction that is experienced by ICU patients may be due to the emergence of delirium. So delirium is a very, very common presentation in hospital units and more so even common in the elderly. So oftentimes we see our loved ones go into the hospital for what seems like a simple procedure, and all of a sudden we see a significant change in mental status. This becomes more and more typical in older individuals, so that usually is secondary to just being admitted into a hospital unit. So in these manifestations, we've seen delirium even being more prevalent. And by delirium, I'm describing a neurocognitive disorder that is, I guess, identified by changes in arousal, such as someone who's somnolent, lethargic, unable to maintain alert level, or has fluctuating orientation, can even manifest with bouts of agitation, confusion. So all those can be part of a delirium. Now, a delirium is secondary to an underlying medical cause. So usually when that medical cause subsides, the delirium should also clear up. Also noted that it is important to emphasize that psychological health concerns, namely depression, anxiety, and PTSD, are often or frequently experienced by ICU survivors. So depression, anxiety, but PTSD. So think back to those initial images that I showed you. Isolation, a strange place, cold or minimal interaction with your healthcare providers, doing all sorts of evasive stuff to just simply keep you alive. And our comfort level, not just our homes, but our loved ones, are kept at a distance. So we must consider moving forward the possibility of a resurgence of PTSD to everything that's been going on. And also there's secondary PTSD, the notion of knowing someone that's going through the process. It will also be something that as clinicians we're going to be on the lookout for. Among survivors of critical illness, younger patients are at the highest risk of developing PTSD, along with those with pre-existing mental health conditions. So those patients that were already our patients, if they were part of those that experienced the disease process and were able to be discharged, then we have to look as clinicians at the possibility of an emerging PTSD. And then children being in these hospital units and maybe not understanding it to the level that maybe an individual that has been able to, I guess, be exposed to the news on a regular basis and has a little bit more acquired knowledge, they themselves will manifest with instances of PTSD. So again, as clinicians, oftentimes our patients won't even know that they're experiencing these disorders. So we have to monitor and make sure to assess for these components so they don't develop more severe presentations or chronic presentations moving forward. And it should be noted that we often refer to diagnoses as being either psychiatric or neurological, but regardless if they're neurological or psychiatric, they always involve the brain. So what we're seeing in PTSD reactions is an overexcitation of the brain due to neurotransmitters being released in reaction to situational factors. Now that coupled with whatever's already happening due to the immediate effects of the disease that is inflammatory by nature, you can see that it's going to be a different type of PTSD that's going on. So that's left to the researchers to look into further, but I believe that this type of presentation will be unique to this disorder simply because of the situational as well as anatomical aspects to it. All right, so this was another study that I looked up on the neuropsychological functioning in severe acute respiratory disorders. So this is not just specific to COVID-19, but can be generalized to this disorder. So survivors of COVID-19 who are extubated appear to be experiencing high rates of cognitive impairment, anxiety, and mood problems. Extubation happens when the individual is able to now breathe on their own, which is a natural step that we want our patients to have. But even though that they're improving, we're still seeing the deficits. So potentially someone can be COVID-free, past the acute phase, and still have a significant presentation. So cognitive impairment, anxiety, mood problems. Those who survived prolonged intubation are awakening to a world that's profoundly altered from when they first became ill. So due to the infection control, prevention, patients are isolated in their rooms without the physical presence of family members, friends, and loved ones. Physicians and nurses often must limit the time spent in patients' rooms to mitigate the risk of infection. So all these factors further drive that notion of the mood problems, anxiety, and cognitive impairment is very, very much bidirectionally associated with emotional status. That means that instances of anxiety, depression will impact your cognition, memory, attention, concentration, problem solving, but cognition, those abilities I just named, also impact mood. So if we identify that the patient has one or the other, we must always be on the lookout and monitor the possibility of the development of cognitive deficits. Let's see, this was a study that basically assessed, they assessed 9 patients, and the take-home message from this specific study, I won't bore you with everything that's stated there, but the notion of the decline was linearly associated with the length of stay in the intensive care unit. So those patients that even if they are able to be discharged, the longer that they're in the hospital, the greater the likelihood of neuropsychological issues. So a decline in attention, memory, praxis being motor function. So all those can be correlated in a linear manner, essentially being positively correlated with length of stay. Okay, this other study here, 81% of the patients that they evaluated had cognitive impairment, ranging from mild to severe, with deficits in working memory, the ability to hold and manipulate information, set shifting, the ability to change a strategy. That's usually associated, well, all these are actually associated with executive function, but set shifting means that when an individual comes up with a solution or an understanding to a situation, and then that situation changes, they're able to change based on task demands. So we saw a decline of 47% in the individuals within the study, and then divided attention and processing speed. Something that as clinicians we become very, very well acquainted due to the prevalence of ADHD and other attention disorders. So executive function, although not significantly associated with intubation, length of stay, or the time from extubation, the psychiatric components were shown to be significantly impacted. So given the frequency and pattern of impairment, it's easy to say that intervention to target attention and executive dysfunction will be beneficial. So this is something as clinicians within mental health that we have to look for, that we will have patients that potentially present with mild to more significant deficits post-discharge, post-acute. So assessing these patients and then establishing a plan of interaction that not just focuses on one component, but knowing that a plethora of aspects of the person's cognitive, emotional functioning may be impacted indirectly and directly by this virus. Let's see. Okay. Severe COVID-19 infection triggers a complex inflammatory response. This is what's been talked about a lot in the news, the cytokine storm syndrome. Essentially is the body's reaction, this inflammatory response throughout your body. And as mentioned before, this is both a reaction to the virus and also to a certain extent caused by the virus as it invades all these receptor sites throughout your body. Stroke, hypoxia, and delirium threatening cognitive health. Well, directly so. Vascularity changes due to inflammation will result in stroke. When there is lack of oxygenation just due to ventilation, such as respiratory processes, we will have hypoxia, which is basically when the brain has a decreased level of oxygen, which can lead to another term called anoxia, when the brain doesn't have oxygen coming to it. And we know that blood is what supplies the oxygen to our brain tissue. So if there's any inflammatory process or blood being deviated for whatever reason due to multiple organ issues or what have you, as well as just the mere ability of being able to breathe in the oxygen and as well as expel the carbon dioxide, this will have deleterious effects in the brain itself. Let's see, the cytokine storm syndrome, coagulation disorders, hypoxia, warrant special attention. So that's something that we've talked about or have heard in the news in reference to the vaccines, but the virus itself would onset a lot of these factors. Let's see. So I have these next slides just kind of like to orient. I wanted to stop there with just the basic information in regards to what the studies have been showing, but talk to in regards to a more relatable aspect, which is this notion of burnout. Okay, as clinicians and healthcare providers in the midst of a situation that no one could really have predicted or planned for, burnout is very, very much something that we have to monitor. So very often we're thinking about our patients families that we forget about our own health. Now, burnout is a very real thing, and attached to burnout is this notion of stress. So we know that stress is something that we're meant to have, but it's meant to be for the acute response. When we have prolonged stress, when we're talking about, months and months of exposure, then we start experiencing significant biological changes. Just like I said before, anatomy is due to both nature and nurture. And if we constantly experienced the exposure to stress, which can lead to burnout, we will have neurological changes. So it's not, again, just the exposure to the virus directly, but it's also to everything that goes along with dealing with the virus. So as clinicians, the focal point is not on only the persons and those individuals that we treat, but on ourselves to be best able to provide them the services. And at in the previous presentation, we were talking about vaccination. So there is a light at the end of the tunnel, and the light is, in great part, is going to be because of the vaccination process. Never in human history has there been a vaccination process that has been this efficient and this quick with implementation and execution. And as we see the numbers of vaccination rise, we will see decreased severe presentation, or at least we expect to see decreased severe presentations. But even with the mitigation of the more severe presentations, we still have to be monitoring for potential consequences that are neurological in nature. As you know, the vaccines are meant to prevent the more severe presentations, but individuals can potentially still have mild presentation of the disorder, and it has yet to be determined to what level they can also transmit. Obviously to a very, very, very much more decreased rate, which is why vaccination has been paramount to controlling this virus and pandemic. Now, what is it that we're working towards? Well, it's the notion of these images, the ability to bring families back together, the ability to be able to bring back that support to everyday life. For too long, we've been socially distancing, which in reality should have been called physical distancing. But I would say the absence of what typically makes us who we are, our human existence, is built upon the ability to interact and to be amongst those that are of importance to us. And our neurological health, not just our emotional and psychological well-being, but the health of our very brains depends on our ability to engage on these tasks. So I'm actually quite hopeful seeing the changes that are currently on in our communities, that little by little this will be more of a reality. And we will see families restored to the structures that we've come accustomed to. Now, hopefully, with everything that's happened in the last year and a half, we've learned to prioritize things a little bit better. I know I personally have. And looking at those things that are truly of value. Because when we consider what it means to have a healthy lifestyle, it isn't just about the medication and the food we consume, but it's a holistic perspective. And we need to take that same notion when it talks about our brain health. Our neurological well-being should not just solely be dependent on one factor, but it's the quality of life we live every day, which obviously has been greatly depleted in the last year and a half. So when we think about what brings us to work and still go into our offices and see our patient on a daily basis, it's not just to help the individual, but to help the communities and hopefully restore a sense of normalcy. So I think that's pretty much it. I know you guys stayed a little bit longer than was planned, so I'm grateful that you were able to stay for all the presentations. Now I guess I will allocate time to address some questions. So I guess we'll go ahead. So I'm not entirely sure where the questions will come from, if it'll be from the chat or if it'll be orally expressed. Chat. The chat? Okay. Let me see. Okay. So I'm not sure if there's a specific question. Nestor, do you see any questions? Let me see. So I'm looking at it here. So was that a question on, I guess, on ED? So as far as, well, my expertise doesn't necessarily go around that general region, but Vascularity changes very much can be responsible for that. So when we're looking at something like ED, we have to consider that it's multifactorial. As mental health providers, we usually focus on the emotional side of it. Anxiety and depression can have direct effects on ED, but so can vascular changes and inflammatory responses. Now, if you're talking about severe brain changes like neuronal atrophy and areas that are very much associated with the regulation of that, then potentially it can be a consequence of direct injury to some of those areas we've talked about. But more than likely, I would assume that it's due to the other aspects of the viral infection, such as the vascularity changes, the cytokine crisis that results in all this inflammatory process. But we're talking about this is a multi-organ diagnosis. The respiratory system, obviously, because of the nasal passages and the lungs and the onset of breathing difficulties and saturation problems, has been on the forefront. But this disease with the receptor sites and the reactions of the body can lead to multiple organ failure. So that's something that can also impact the other aspects of the body. So when one organ becomes impacted, another organ can potentially be affected and so forth. So in mild cases, I'd be curious to see the literature to see what is exactly the presentation, but I would assume it's due to the vascularity changes as well as the emotional stuff we talked about, the PTSD, the depression, and so forth. Okay, so what strategies do you recommend I use at a treatment center? So as far, well, it would depend on the type of treatment center and the role of the clinicians. What I would say is keep in mind, obviously, safety restrictions, but trying to establish a sense of normalcy for all parties involved, for patients, for families, and for clinicians. So anything you can do that facilitates that while adhering to maintaining safety factors, that would be the main component I would suggest. So yeah, I would say that would be the main aspect. As far as if you're, let's say, in a mental health clinic that's outpatient, ensuring that that the clinicians aren't, experiencing symptoms of burnout. So creating a dialogue and discussing that with your patients, also creating a dialogue in which there is open discussion of the potential effects of this diagnosis. So they are also aware of what can come and have expectations in regards to it. But this isn't also about fear mongering. We don't want to inject further fear onto those around us. So it's always important to know how to scale things. I always like the idea that we should live our lives never by denying by what is, but never allowing ourselves to be defined by our weak points. So essentially, being able to identify those instances that are of concern, but knowing that everyday life is much more than those areas of concern. So that's where I would lead into that. I know it's a very general response. Is there a difference on the effects of COVID patients that had to be hospitalized versus the ones who just experienced minor symptoms? Well, the difference would be the severity of symptoms, of course. But I remember early in the summer, I consulted with someone in regards to just finding out more about the plethora of symptoms. And if you list all the symptoms associated with this disorder, it's like everything under the sun. I had a patient that never experienced any respiratory issues whatsoever, but was migraines. Migraines, severe migraines, which obviously for me, being in the neuropsychological field, is of concern, but they didn't really have any other symptoms. Never lost sense of smell, didn't have a fever, but it was migraines. And lo and behold, because everyone was getting tested at that point in time, they found out that they had COVID positive. Now, this was someone I was seeing via telehealth at the time, but there is, I would say the severity of symptomatology would be the biggest difference between those that are hospitalized and also the secondary emotional factors of going through the hospitalization. But let's not dismiss those that have not been hospitalized that there is still the prevalence of trauma, secondary trauma. We remember in 9/11, the majority of the population experienced a reactionary trauma to witnessing and vicariously experiencing everything that happened in the Twin Towers, and we're very much going to be seeing that now. What is the immunological response between vaccination for COVID? Oh, let me see. Let's see. COVID versus flu vaccination. Reason being that people confuse flu symptoms versus respiratory deficiencies. So, vaccination for COVID. So, honestly, this is a question better answered by someone who's a physician, but I'll do my best in regards to what I've seen with my patients. Now, what I would tell you is very, very individualized as far as the immunological response. So this, well, not all of them, but the Pfizer and the Moderna specifically are very innovative vaccines. Let's not lose sight of that. The advances that have been made to counteract this virus will have implications for treatments moving forward. The use of RNA has been very innovative, and so what's allowed this to be very, very potent. So it's essentially a new way. Typically, when we think of vaccinations, we give the patient a weaker version of the pathogen in order for the body to form a response, essentially identifying and then forming an immunological response in order to counteract the symptoms and prevent severe presentations. But what we've done with the RNA transcription has been amazing. So, or at least I think so. So it's going to be different now. Confuse flu symptoms with respiratory deficiencies. Flu-like symptoms seems to be the general response to ailment, and this predates COVID-19. Respiratory deficiency, we're talking about when your saturation level, essentially how much oxygen you have in your system, is decreased. And I mean, we don't even need that much of a decrease to get into very, very significant issues such as acidosis. So a respiratory deficiency is quite different in severity than the typical response, but I hope I'm answering the questions correctly. Again, I do think that question would be probably better served by a physician, especially someone who's like a pulmonologist in the front lines dealing with the respiratory aspects of this disorder. Why do certain patients who test positive for COVID-19 present asymptomatic? Well, that's the golden question. That's not specific to COVID-19. For almost any virus, there can be potentially asymptomatic individuals and still be carriers, or have a presentation that's very, very mild. That's just individual variation. So there are certain factors that could potentially exacerbate that, such as the utilization of, well, I don't want to speak out of premise, but the pre-existing history, genetic factors, all sorts of factors can be correlated. But with many viral infections, some individuals can just simply be asymptomatic or have a delayed response. So it's very, very much individualized. To this specific disorder, I've seen some studies talking about some of the characteristics of those that are asymptomatic. We've heard that younger individuals tend to be more asymptomatic. It could be just because of their immune response being that much stronger. Also, the prevalence of comorbidities as we get older, the medications we take that could potentially interact with the receptors that we've talked about. That can all add up to why certain individuals may have different presentations. But I personally have not identified a specific profile to say this is why exactly. It is very early, but these people can recover from the symptoms after COVID experience without the need of medications. Okay. Is there any reason that could? So right now I'm just reading the questions. Let me see. So the last one, is there any reason that could explain why some people tested positive? Oh, I think, so if they work in this, tested positive and others don't to COVID, if they work in the same field, same environment, and same type of clients, is this related to how people handle stress? That's an interesting correlation. I mean, stress is something that does affect our immune response. We know that. The greater your stress, the lower your immune response. But remember what I said earlier on. Stress is a natural response. We have stress for a reason, It's for survival. It's just not meant to be prolonged. That's the key point. But when we do have prolonged stress, our immune response does decrease, so it may make someone more susceptible. Also, under stress, we may not be adhering to safety guidelines as adamantly as we would, and we are tasked in different ways. Maybe our concentration and other factors dwindle. So yeah, I would say it's multifactorial, but directly stress being associated with sympathetic arousal, the release of certain chemicals and hormones in the body do generate a response in the body that potentially has implications for immune response. That may make someone more susceptible. So I would say that that is a key point of reference. And just in general, I would say a healthy life is one in which we have a controlled level of stress. Okay. Let's see. Yes, there are studies looking at that. I didn't cite any for this presentation, but there are studies looking at that. And so that is things that we're going to be monitoring. Obviously, there's always going to be the research question in both asymptomatic and symptomatic individuals. What are the long-term effects? So acutely, we talked about delirium, changes in memory, attention, that could potentially improve, but also what about the individuals that initially don't show those signs or are masked by other more severe presentations that are acute? What happens long term? So this may result in longitudinal studies following patients long term and could potentially result in serial testing, whether it's neuropsychological measures. I would be interested in functional imaging, to be quite honest, your PET scans, your SPECT scans, and seeing how reuptake of certain isotopes and blood flow are in different areas of the body, more so than things like MRIs and CTs. So I would say functional imaging would be interesting with these individuals. And then looking long term, does it increase the prevalence of things like mild cognitive impairment or potentially even a dementia? Those are things to be looked for and seeing what the body does long term with these presentations. So, the last question there, any thoughts about those individuals that have lost their ability to walk and have had to receive physical therapy and be retrained? Well, as a clinician at my facility in the hospital, I often see individuals that experience traumatic brain injuries, spinal cord injuries, and physical therapy is a big part of that. The main thing that I always say to my patients and family members, et cetera, is the initiation of things like PT. So physical therapy, the earlier you can do it, the better. And I would say for any type of intervention, that's very important, because if there's any chance for recovery, it's the earlier you do it, because your body will reorganize itself based on its constant state. So if it experiences, let's say, a partial lesion or a partial, I guess, fill in the blank, it potentially has the possibility of recovery if it is something that is actively done, but there will be thresholds. So essentially what we would describe a diminished point of return. I never want to say completely a point of no return, but a diminished. So early initiation of things like physical therapy, occupational therapy, and looking at patient response would be the biggest recommendation I have. It's going to be multifactorial, pre-existing history, associated risk factors, and the unique presentation to that individual as to why essentially they're experiencing the difficulty with ambulation. But initiation of treatment, I would say across the board, would be the recommendation. So does COVID play any role in hormonal imbalances? Given that it is kind of this catastrophic, multi-systemic component, I would say yes. And we've talked about stress response, which does involve hormonal aspects such as adrenaline. So as far as other regulating hormones, anything regulated by your pituitary gland, hypothalamus, adrenal, and etc., it would be essentially how they're impacted at the receptor sites and how other organs are impacting those. Always think of your body as a system. Any change at any point in the system will affect other systems. And I know in the mental health field, we often talk about systems theory, when we can impact an individual by changing the system, or we can change the system by impacting the individual. Consider the same thing or in your system as your organs and your body and organ systems. By changing something in a positive or negative way, it's going to have a cascading effect. I can tell you the stress-related hormones, those associated with specific areas, but overall, I would say that the answer is yes. Now, to what level? I would say is very, very much individualized and has not been a focal point at this time with the management of this disease. Now, can it be subject for research? Very, very much so, and something to monitor later on and see how those individuals experience hormonal thresholds. I mean, one thing I didn't really talk about is pediatrics. I personally am not a pediatric, I don't specialize in pediatrics, although I do see pediatric patients for specific presentations. But in pediatrics, we saw a manifestation during the summer where there was an onslaught of patients experiencing cardiac issues and very, I don't want to say atypical presentations, but when we talk about the general presentation to COVID-19, it was quite different. Now, with these patients, they're going to have to meet certain thresholds as they develop and grow older. So if you're talking about exposure as prepubescent, adolescent, and then as they go throughout life, some of these thresholds should be monitored to see if there is an impact moving forward and in the long term. After the vaccines, like a month later, experienced depression, like for 2 weeks with Moderna. So I guess the question is whether the likelihood of experiencing depression after vaccine, so after vaccines, like a month later. So I'm not, I haven't seen much on that. Now, I have seen significantly variable results as far as manifestations post-vaccination. I had the Pfizer vaccination, but I've known individuals that have had the Moderna, and I've known, I think, at least one person that had the Johnson and Johnson. So it's been quite variable responses, with some individuals having no symptoms whatsoever. You know, getting the vaccination and the next day, you know, being back to work, which that's kind of how it went for me. I even think I worked later that night. But then there's other individuals that experience significant impact the second day of the first dose and the second day of the second day of the first dose and the second day of the second dose. So it is quite variable. I haven't really seen much on the correlation of depression and vaccination. I think it's an amazing study as well, to basically just evaluate what are the psychological, you know, consequences or effects of everything that's associated with the current presentation. So everything from the disorder itself, from being a family member of someone who's had the disorder, an acquaintance, working in healthcare, and also the vaccination process as far as acquiring the vaccination, getting the vaccination, and so forth. I think these are all amazing ideas to look for in research. And as you can see, there's a lot of questions that need answering. With every answer, there's going to be so many more questions. So for you guys that are research inclined, this is like, you know, open season for that. There's so many questions, and every question you guys are posting here on the chat can lead into a study. So every single one can potentially become a study in its own. So COVID patients have also reported saying, yes, so COVID patients have significantly reported depression, anxiety. We submitted, and I say we here at Albiso, we submitted a study, which I didn't include because I still think it's being reviewed, evaluating the presentation of emotional factors and identifying that within a college age population. So maybe once we get the the final, I guess, determination of the study. If it is accepted and published, then maybe that's something that we can talk about later on, because I think it'd be more applicable to the population we come in close contact here in the university, as far as what some of the sequelae and what were some of the signs during the process. Okay, so. Okay, so eyesight changes. Yeah, there's going to be a plethora of symptoms, and as I said before, it's so many symptoms attached to this disorder just simply because of how it functions, that eyesight changes is something we have to look for. Obviously, we know olfactory. I mean, I would say everything in our checklist is something we have to evaluate and see its correlation, whether it's direct or indirect. I mean, hopefully the eyesight changes are transient, so that would be something to monitor as far as if it does get better over time. Hopefully you're being followed by a neuro-ophthalmologist or an ophthalmologist that can monitor that and see what are the appropriate implementations along the way. But yeah, again, this is a multi-systemic, infiltration. It's not just our lungs that are being impacted, but it's our bodies as a system and in general. And neurologically speaking, our nasal passages are a gateway to our brains. So through those receptor sites and then secondary impacts such as vascularity changes, inflammation, you can see how other systems that maybe weren't directly impacted can potentially be impacted. So again, hopefully that's something that's transient and with time does get better. But if you are being followed by a specialist, they would be the best one to provide the recommendations as moving forward on that matter. Me personally, have I come across? I want to say one of my patients that reported migraines secondary to the virus, I want to say they had tinnitus. I want to say they did. Now, again, usually when you're talking about COVID-19, a lot of symptoms get swept under the rug just because of the focus is on, preserving life, stabilization, medical stability. So some of the other stuff, goes through the wayside. You can experience tinnitus, even vestibulopathy, coordination issues. So our vestibular system and our inner ear is very, very sensitive. So tinnitus can be due to multiple effects. It can be peripheral, such as an issue with the inner ear and so forth, or it can be central within our brain. And this can also result in what's called vestibulopathy, which is kind of this imbalanced vertigo feeling. So those are things that we're going to have to look for. Again, there's multiple areas of the brain that are impacted by the virus directly. But then if you consider the vascularity changes, the inflammatory process, then you're talking about that it can be impacted as a whole, affecting other systems as well. Now, tinnitus, ringing in the ear, can be caused by a plethora of things, and our inner ear can be impacted by viruses. Sometimes a cold, a flu can elicit the tinnitus and the vestibulopathy. So it wouldn't be something that'd be too surprising for me. Me personally, again, what I've seen is patients with reports of changes of smell, migraines, balance issues, coordination issues. But again, the focal point has often been on other factors. Let's see. Oh, now it's not so common. Okay, so that's very interesting that the migraines have subsided. So that would be something interesting to monitor and also kind of evaluate some of the aspects that were triggering before and seeing how the changes that have been subsequent to the virus maybe have altered some of those things that may have been triggering before. So that's very interesting because what I've seen has been the opposite. So, but again, some good news from it, I guess. Okay. Alrighty. So I'm not seeing any questions. Sure, let's go off topic. Oh, yes, I did read that too. Again, that's probably a question for someone who's a hematologist or someone who's dealing with this on a regular, but I did read that certain blood types were more resistant than others. So I don't necessarily want to go too much into that because I don't want to say something that's incorrect. But yes, I actually read a couple of I want to say studies, but I didn't. I mostly just glanced at the findings. But yeah, there's been some findings that correlate susceptibility and also severity of presentation to blood types. But I would say I would rather someone else comment on that factor. And also the studies are there for you guys to look up. I saw this probably in the fall is when I read about that, so I haven't really looked into it since. But it'd be interesting long term also to look at factors like blood type and how may that be related to long term aspects as well. But yeah, I read something similar, Dr. Diaz, as far as susceptibility to more severe presentations. If I had to guess, it probably has something to do with the ACE receptors and maybe some other aspects associated, but now I'm just speculating because I don't have those studies in the forefront of my awareness right now. Okay. Nestor, I believe Dr. Barroso is speaking, but I don't hear her.
Please, everyone, first of all, thank you, Dr. T. Thank you, special thanks for all the presenters who participated this year's event, as well as our IT support staff. Thank you, Nestor. You're amazing. Participants, please, I'm going to go ahead and put the evaluation link in the chat box, as well as the document link. If you want to gain access to the PowerPoint presentations, here is, oh, it was already said by Dr. Barroso, she beat me to it. But there you have it, both links, evaluation and documents links. And please fill out the evaluation in order to receive a full credit for your attendance in order to complete your certificate, as well as nurses. We're going to need that evaluation to be submitted so that we can go ahead and forward off you a key code so that you can get your continuing education units. Are there any other last closing comments? Well, then I want to go ahead and wrap up by saying once again, thank you, and till next year. Yeah.
Thank you very much. Stay safe, everybody. Dr. Turgeman, thank you so much for your presentation today. Dr. Chase and Professor Lescano, we appreciate it. Keep being careful out there and supporting each other as we take steps out of this historic pandemic that we have been living through. Take care.